Good evening, ladies and gentlemen. My name is Dr. Martin Wekesa-Wafula, CEO Mama Lucy Kibaki Hospital. As we commence this documentary, we are celebrating the past 100 days of my work at Mama Lucy Kibaki Hospital. Ever since I joined this facility, we have experienced tremendous change by first doing our strategic plan 2024-2029. Our mission as a hospital is to excel through provision of quality, specialized evidence-based and promotional medical training and research. We pride ourselves in our values that are symbolized by the name of the hospital, MLKH. M meaning mastery, that we endeavor to provide our services at the mastery of the skill in the quality healthcare delivery, that we will remain loyal to the facility and to the county government of Nairobi City County, that we will treat our patients with kindness, and that we will be honest in all our endeavors.
Deep in the heart of Nairobi, Kenya, stands a beacon of hope for hundreds of thousands, Mama Lucy Kibaki Hospital.
That this hospital started in the year 2008 when the first stone was laid, marking the beginning of the construction of the hospital. It was first launched by the late His Excellency President Kibaki.
This institution, named in honor of the late First Lady Lucy Kibaki, has grown to symbolize resilience and dedication to public health.
And named Mama Lucy Kibaki Hospital in honor of the former late First Lady. And as a mother, the hospital has endeavored to provide services that promote mothers and children's health, men and elderly health across not only in Nairobi, but it has covered Nairobi and its environments. We have been able to serve other counties like Kajiado, Kiambu, Machakos, Kitui.
Established with the mission to serve the community, Mama Lucy Kibaki Hospital has undergone a remarkable transformation under the visionary leadership of the board.
My name is CHRP Dorcas Kemunto Wainaina. I'm the chair of the board of Mama Lucy Kibaki Hospital. And as a board, we started in May 23rd, 2023, and we are 7 in our board, and that includes Madam Susan Wanjiko Wasakaja. She is the vice chair of the board. We have Mtumishi Chris Wanjohi is the MCA, Komarok Ward. We have Madam Jennifer Mumbua. We have Madam Freda Nduati. We have Madam Yvonne Makoha. And we also have Mr. Ronald Ingala, and our secretary to the board is our CEO, Dr. Martin Wafula Wekesa. And as a board, it has been 1 year of a lot of work and achievements at Mama Lucy Kibaki, ensuring that our hospital is steady, stable, and running as efficiently as expected. I would like to take this opportunity to thank His Excellency Governor Arthur Johnson Sakaja, who appointed us to this board to support him in making sure that quality healthcare services are provided to the residents of this county.
Initially a small facility, it has expanded to become a crucial healthcare provider for not just Nairobi County but also neighboring counties, bringing essential medical services to a wider population.
Mama Lucy Kibaki Hospital serves a catchment area of about 300,000 people,
but also it extends to other counties outside of Nairobi. It actually goes to Kajiado. We get patients from Garissa, we get patients from Machakos and far off and other places because of the services that we provide here. And we've had to reconfigure this hospital to be able to serve the needs of the patients that come here.
Mama Lucy Kibaki Hospital is not just about general healthcare. It boasts a wide range of specialized services. One of its crowning achievements is the establishment of the first public eye hospital in Kenya at the Mama Lucy Annex. Here, patients have access to advanced laser surgeries and in-house glasses production, ensuring comprehensive eye care for all.
And by opening our eye hospital, we are now serving the entire country. Our eye hospital opened her first doors by a launch last year, October, by His Excellency Governor of Nairobi City County, Governor Johnston Arthur Sakaja. And as we speak, currently it is serving 300 patients per day, and we are operating on 30 patients.
Mama Lucy Kibaki is the first hospital to ever have a public eye hospital, because the other public eye hospital in Africa is in Pretoria in South Africa. And therefore, what we are saying is that you need your eyes taken care of, laser surgery, checkups. We produce our own glasses. It is done at Mama Lucy Annex, the eye hospital that's 500 meters away from this particular hospital.
Nimefanyiwa, nimeoshwa, nimewekewa lens. Kama ningeweka huko kama kijabe, ningekuwa sio pesa kidogo, kama 80, a range of 80 to 100,000.
Kwa umri wa miaka 91, 91, tumekuwa tukitabika na hii, tukishughulika na hii shida yake ya macho kwa muda wa miaka kama 10 hivi imepita. Tumetembelea hospitali mingi, lakini nashukuru sana kwa vile ametibiwa vizuri, amefanyiwa operation na sasa hii anaona. Ani matibabu mzuri sana, madaktari ni wazuri. Kwa hivyo namshukuru sana gavana wetu Bwana Sakaja.
Kwa majina naitwa Geoffrey Musiria, katibu wa afya jimbo la Nairobi. Leo hii nimekuja katika hiyo hospitali yetu ya Mama Lucy Eye Hospital Annex. Nimekuja kuangaliwa jicho langu. Hii jicho liko na shida. So nimesema nije nitibiwe, niangaliwe. Nimeona daktari amekagua macho yangu, ameniambia hili jicho liko na infection na amenipatia dawa ambayo nitatumia ili iweze kumaliza hii infection. Kwa sababu ambao nimekuja katika hiyo hospitali ni kwamba nataka kuhakikishia wananchi wa Nairobi kwamba hata sisi pia tunakuja kutafuta services kwa hospitali zetu za jimbo la Nairobi. And another thing I want to say is that we trust our services. That's why I came to seek services in our facility, to also give the public the confidence that can also come and seek services here. Ndio niko na bima ya afya ambao naweza tumia katika hospitali zile kubwa za private, lakini nimeonelea nije hapa kwa sababu tuko na wahudumu ambao wamehitimu, and this is the best facility.
I'm Dr. Fatma Khalid. I'm a consultant ophthalmologist at the Mama Lucy Kibaki Eye Hospital. So I'm going to take you through the slit lamp examination. So the machine that is right in front of me is called a slit lamp. It's usually what we use to examine the eye. So when the patient comes in, we position them such a way that their head rests in the headrest position. We have their forehead and their chin resting here, and we adjust the height according to the height of the patient as well. And once they are here, then we are able to illuminate the machine so that we can be able to visualize the eye. So we have an illumination system, we have a viewing system, and a magnification system, so that the eye then appears big. We're able to see the disease closely, and we're able to diagnose and treat. So with the slit lamp, we're able to look at both the anterior segment of the eye and the posterior segment using a lens. For example, what we have here is a 78 diopter lens, which we use to focus the light beyond the lens so that we can be able to look at the retina, the optic nerve, and the macula of the eye. So for patients who require further examination, we are able to put in a dilating drop into the eye so that we can dilate the pupil, and then or a deeper look into the retina, especially those who have chronic diseases like diabetes, hypertension, and such. We then come to the indirect ophthalmoscope. This is usually worn on the head, like in this case. And once it is put on the head, we use a 20 diopter lens to examine and focus the light into the eye. This enables us to pick diseases that are not easily seen with the slit lamp, especially in the posterior segment. Now, once we've seen a patient, we've been able to examine and diagnose the diseases. We have some diseases that we manage with eye drops, which we have our fully equipped pharmacy with the eye drops. And then we have other diseases that require intervention, like surgeries. So we have commonly seen cataract in our facility. We've also seen glaucoma. We have cases of trauma, which all require then to take the patient to theater so that we can operate on the eye so that the patient can regain their vision. In theater, we have our operating microscopes. We are able to do all the surgeries under local anesthesia, and very soon we are going to start general anesthesia, especially conditions that are found in children who cannot cooperate during the operations. So what we do at Mama Lucy Eye Hospital is we do eye consultations, we do full eye checkup. Those who require glasses, we have an optical shop. Those who require drugs, we have a pharmacy that is fully equipped. And those who require surgeries, we have an operating theater as well. And on top of offering services to Kenyans in terms of eye conditions, we also get students from different teaching facilities. We are able to train eye doctors here in our facility. And recently we managed to get an operating microscope that has a camera to record our surgeries so that we can enable the teaching aspect of the hospital as well.
The hospital's strategic location and commitment to comprehensive care makes it a lifeline for many who would otherwise have limited access to medical services. Innovation thrives at Mama Lucy Kibaki Hospital, where cutting-edge technology meets compassionate care. The introduction of a state-of-the-art 128-slice CT scan machine has revolutionized diagnostic capabilities, allowing for detailed and accurate imaging that aids in the swift diagnosis and treatment of various conditions. Welcome to the Radiology and Imaging Department at Mama Lucy Kibaki Hospital. Operating 24/7, our dedicated team of 5 radiologists and 18 radiographers provides a wide range of diagnostic services. Our department is equipped with 2 general X-ray machines, offering comprehensive X-ray services around the clock.
My name is Isaac Mutwa. I welcome you to Mama Lucy Kibaki Hospital, particularly to Radiology and Imaging Department. I'm the radiographer in charge, coordinating radiology and imaging services at Mama Lucy Kibaki Hospital, and also supervising of radiographers and the students on attachment. The department is run by 5 radiologists and 18 radiosonographers, and we work 24 hours. The department has the following modalities. We have X-ray 2 X-ray machines which we offer X-ray services, general X-ray machines, work 24 hours. We have ultrasound services, doing normal ultrasound services, basic ultrasound services, and also specialized ultrasound services like Doppler. We have a cranial ultrasound which are done within 24 hours. Also, we have other services like OPG, done 24 hours. We have also 2 portable X-ray machines which do X-ray in the ward, in ICU, also in the Lino, to serve those patients who cannot come to the X-ray department. Also, we have another machine in the theater called image intensifier, which assists the surgeon in operating. That service is still available. And recently we acquired a state-of-art 128 CT scan equipment, which is performing all specialized examination like cardiac CT scan. We see CT, pulmonary angio, CT autograph, CT urography, and the CT filograph. The machine is working 24 hours.
Today we just finalized the installation and testing and running our CT scan, 128 slice CT scan. And as we indicate that the healthcare of Kenyans has to improve, and the reason why we did invest in this CT scan from China, Anke manufacturers. These manufacturers have been doing this since 1970s. This CT scan is one of its own kind in this country. 128 slice CT scan. In this country there are only 3. And we are proud that Governor Sakaja deemed it fit for us to have the CT scan here so that we are able to serve Kenyans.
Our MRI services currently include brain, spine, and joint examinations, with plans to upgrade and accommodate a wider range of procedures.
Also, we have another machine which is a bit advanced, MRI services, which only perform brain, spine, and joint examination.
And this is MRI department, and this is a place where we offer MRI services. And right now we are having an MRI machine with a strength of 0.3 Tesla and able to do several and a series of examinations. We have MRI brain, MRI of the lumbar spine. If you have spinal issue, vertebral column, we can do. The Mombi view also we can do. This machine can do that. Then also it does pelvic MRI, it does C-span MRI, it does thoracic MRI, it has oculi MRI. And in those services we're offering, because this is a public hospital, we're offering at a very affordable price, and the examinations are covered also by NHIF insurance cover and other insurance covers. Also, we offer through the cover of cash, and it's a very affordable price as compared to other facilities. We offer at 12,000 Kenyan shillings only. We mostly based on the life standards and levels of Kenyans. That's why we offer at such an affordable price. Welcome all of you to Mama Lucy Kibaki Hospital for MRI services.
Then also we have advanced, these days we have echocardiogram services available from Monday to Friday, and is performed by echocardiographers. those have been posted to the hospital.
Welcome to Mama Lucy Kibaki Hospital. My name is Henry Koskei. I'm a radiographer by profession. Welcome to radiology department, and this is where we are now at the cardiology echocardiology room, where we have an echo machine. This machine specifically is the first one in Nairobi County hospitals. It is the only one of its kind that has been planted in Mama Lucy Kibaki Hospital. And this machine, its purpose is basically for the evaluation of the heart evaluation, all the conditions that our customers or our patients are suffering from, the heart conditions, including heart failure, pulmonary diseases, pain at the chest. This machine is able to see all the vessels and to see any pathological conditions which can be seen in the heart. If the heart is blocked, you can see all the clots, all the blockages. This machine can be able to demonstrate where the problem is. And we want to thank His Excellency the Governor, Governor Sakaja, for enabling us to have this equipment in our hospital.
Echocardiogram services are available from Monday to Friday. We also offer multiple payment options, NHIF and other insurance plans, ensuring accessibility for all patients.
Then the services are paid, you can use cash payment. Also, you can use NHIF in payment, and also other insurance companies which are cooperated with by Mama Lucy administration. Also, we have advanced in technology in site of reporting. We have introduced teleradiology services, which after the radiographers have done the X-rays, the CT scan, the MRI, the report can be reported on teleradiology. So the reporting is 24 hours, which has reduced the turnaround time for the patient, and also for the as assistants, our radiologists who can report even when they are not within the hospital.
In addition to these services, our hospital also provides essential cardiac diagnostics. Dorcas Wairimo Kamau, a critical care nurse, coordinates our ECG room.
Welcome to Mama Lucy Kibaki Hospital. My name is Dorcas Wairimo Kamau. I'm a critical care nurse working in the ECG room. I'm coordinating the ECG. ECG, this test we are doing it for, it is called electrocardiogram, a basic function test that we do for the patients who we want to check whether they have any heart issues or we want to rule out or just a basic health check.
The electrocardiogram, ECG, is a basic yet vital test used to check for heart issues or conduct routine health checks.
So when the patient comes in, we connect them to this machine, and it's a 12-lead ECG that usually produces the electrical activity of a patient so that we can be able to know if they have any heart issues. Then we send them back to the if they have an echo test, we send them to the echo room and then to the cardiology clinic so that they can be able to see the consultant.
We perform 25 to 30 ECG tests daily, ensuring thorough cardiac monitoring for our patients.
In an average per day, we see 25 patients, and we are open Monday to Friday, 8 to 4 p.m., and all are welcome.
So welcome to Mama Lucy Kibaki Hospital. My name is Helen Y, the Nursing Services Manager. In Mama Lucy Kibaki Hospital, we have both inpatient and outpatient services. We have a dedicated human resource We have a pool of all cadres to include consultants, doctors, nurses, physiotherapists, nutritionists, and among others. We offer inpatient services in pediatrics, adult outpatients, special clinics, mother and child care, and in our inpatient departments, we have pediatric services, newborn services, surgical services, internal medical services. We're opening new services in orthopedic and neonatal ICU. And currently we are running a critical care unit that has really helped us manage our complications. And due to this, our level of complications to patients has become very well managed. We are able to manage complications and reduce the number of deaths, especially to our mothers. And this has been a very good uptick in the hospital, and it has really showed us very good outcome in our hospital. We have quite many patients who are coming in our services. We might be congested, but our patients are happy that each and everyone is getting services. So welcome to Mama Lucy, where we serve patients with quality, where we serve patients with dedications, where we serve patients with humility, where we serve patients with a good heart. Karibuni.
The hospital's dedicated maternity and neonatal units are designed to give every new life the best possible start. From prenatal care to postnatal support, the teams here work tirelessly to ensure the health and well-being of mothers and their babies.
My name is Lawrence Oidra. I'm a nurse in postnatal ward. This is one of the acute rooms where we receive our patients from theatre. Currently, we are preparing to receive a mother from theatre who has come as a referral in from a lower level facility who has undergone emergency cesarean section, has gotten a bouncing baby boy, and she's ready to be monitored in postnatal. Once the mother comes in the ward, we have state-of-the-art equipment. We have a monitor where we check the vital signs of the mother, the blood pressure, which is displayed on the monitor, which can continue to be monitored. Then we have the thermometer. We keep on monitoring the vital signs, the SpO2 machines to monitor the oxygen levels of the mother and also take care of the baby. So welcome to Mama Lucy, where we care for our mothers the best. Thank you.
The new Pediatric Intensive Care Unit and Neonatal Intensive Care Unit, NICU, have significantly enhanced the hospital's capabilities.
My name is Beatrice Jabi Joroge, a neonatal nurse working in newborn unit, Mama Lucy Kibaki Hospital. And this is our upcoming newborn intensive care unit. We have machines like ventilators. Ventilators will help babies to breathe. Those who are not able to breathe, they will be intubated. We have oxygen to support them because they are not able to breathe. They will need oxygen. We have a sucker if they have anything on their airway. Then this machine, when the baby is in this machine, the baby will need a monitor to monitor how the baby progress is continuing and the vital signs of the baby. And then this baby needs to be in a warmer environment. And the environment we have a warmer that provides warmth to the baby so that this baby will be comfortable in this area. This baby will need to be fed, and this baby will need to be given drugs. We have syringe pumps that will deliver to the baby, and the syringe pump will deliver drugs, they will deliver fluids, they will also deliver even feeds. We also have a phototherapy machine. A phototherapy machine is a machine that deals with the high bilirubin levels of a baby, and most of the babies they develop jaundice during their care, or even during their care, their life in the hospital. So they will need a phototherapy machine. This is a very high quality machine. This machine provides high intensity and low intensity of phototherapy lights. We also have a CPAP machine. CPAP machine is always given to a baby who has some effort to breathe, and they also need some support to breathe. This CPAP machine is also connected to oxygen, so we have piped oxygen in this room where we shall be delivering this baby CPAP to babies who need the care. Babies on CPAP will still have to be in a warm environment, and they will need to be kept warm. So we still have several of the warmers in this room, and also the same baby will need, maybe if the bilirubin levels are high, they will need the phototherapy machine. In that aspect, we also have, there are several machines, and they will deliver to babies who will need intensive care in this hospital. So we shall be able to deliver and give intensive care to our babies, those who we have been referring to facilities like Kenyatta or KU. They will get those facilities in our facility. Thank you for listening to me, and please welcome to and get these services from Mama Lucy Kibaki Hospital, which is a growing hospital with all dynamics. And we can see that now we are going to get a NICU in Mama Lucy. Thank you.
The male gynecology clinic, an orthopedic ward with an orthopedic theatre, and the expansion to 5 functional theatres reflect the hospital's commitment to comprehensive and specialized healthcare.
My name is Roslyn Afandi Chahilu. I'm a nurse working in Mama Lucy Kibaki Hospital, which is in the Eastlands of Nairobi, a busy place. And we thank God that we're giving services to our nearby clients and relatives. I work in theatre, operating theatre, and we do all cases that as pertains as surgery, from obstetrics, gynecology, general surgery, we have orthopedics, we have even plastics. We do them to the entire week. And normally, like obstetrics, we do daily. Emergencies, CSS, we do daily. We have even those we admit for elective cases. And like today, we've already done 4 cases. And normally in a day, a 24-hour shift, we can go even up to 30 cases. And we are busy. We are actually busy in the hospital. And this is our place where we receive our patients, and it is also a recovery area. From that door, when we receive a patient who is fully prepared for the surgery for that day, the patient is received. You check for everything that is supposed to be done before the patient is received. Then the patient is received in theater. We have 3 theaters running every day. During the day, we run 3 theaters. During the night, we run 2 theaters. Why 3 theaters during the day? Because we'll have elective theater list, which is done in the 3rd theater. And the 2 theaters are led for emergency cases. And then these other cases, we do elective cases from Monday to Friday. Weekends, we are left for emergency cases. And emergency cases, we have the obstetrics, general surgery, and even orthopedics cases. So when we receive our case, we are finished. The CS is done. The patient is again received here back at the recovery area. And here we have a lot of things we do. We have the machines that continue monitoring our patients after surgery, because that is a patient who needs a 15-minute check because of the pulse, the blood pressure, the saturations, and even the respiration.
We have not forgotten a boy child. We have started the first male gyna clinic, which is held on every Monday, so that we are able to address reproductive health issues that relate to men and boys. Additionally, we have managed to expand our laboratory that now our lab is able to do all lab tests, all biochemistries, hematology, microbiology. We are able to do pathology. Additionally, we have expanded the lab to having an inpatient lab so that the patients who are in the wards are able to be attended separately. We have an outpatient lab and a centralized lab. Availability of essential drugs to a tune of 86%.
Welcome to Mama Lucy Kibaki Hospital and welcome to the Department of Pharmacy. My name is Dr. Evans Ochoki Ayenga. I head the pharmacy department. But professionally, I'm a pharmacologist and toxicologist, specialized pharmacologist and toxicologist. I'm also an epidemiologist, but definitely I head the Department of Pharmacy. I want to talk about our department. Our department is here to provide medical services like pharmaceutical services to the patients. We ensure that we give quality products. We ensure that all our patients receive drugs that are required for the treatment of their different ailments. And we also ensure that all the diseases that are diagnosed within the facility or the hospitals, the patients are able to receive the drugs and they are able to get the required services. Our department also strives to partner with various hospitals in terms of therapeutic management, ensuring that we reduce issues like antimicrobial resistance within our patients, and we also support and give community services in terms of the patients who want to access medications are not necessarily treated within the facility, and they can still come in and get affordable quality drugs. So we basically assist the community in all possible ways. We give pharmaceutical advice to patients. We monitor drug interactions. We monitor side effects. And we also try as much as possible to enlighten our consultants on the best practices of prescriptions and give alternatives where needed so that our patients can receive all the services. So we are here to urge our patients that what we are providing here is quality. We have moved from those days when we used to have a lot of stockouts and drug missing, but now we are able to provide our pharmaceutical care perfectly. We are able to ensure that we get our supplies on time. We have partnered with quite a number of NGOs that are able to donate, provide some of this medication so that we don't have stockouts, and we guarantee the public that we are here to listen, we are here to provide services, we are here to give quality, and we are sure that we'll continue improving and giving better pharmaceutical services, with better counseling services to those patients who believe they require counseling services. We are also here to ensure that there is patient safety in terms of pharmaceutical care, and we also strive as much as possible to track down our patients and see the recovery rate so that we are able to ensure that we don't have further disease outbreaks, maybe because of poor medications. So I urge all the patients to have confidence in our public institutions, to have confidence in Mama Lucy, especially Mama Lucy being an excellent institution within Nairobi County, and come and receive all these services. We guarantee you that healthcare is our priority and our business, and we are here to provide the best services to our patients. So I thank you all, and I'll be eager to wait and serve you even better, and listen to your complaints even much more, so that we are able to move Kenya to a level where we have public health care that is universal, accessible, and affordable to all Kenyans. So this is our pharmacy, inpatient pharmacy. You're free to join and see how we are providing our services to the patients. So this is our inpatient pharmacy. This is now where we provide services to patients that are admitted in our wards. We ensure that we do a follow-up on patients and give them the best medications. As you can see, this is part of my team. They are busy handling patient files, and I'll let one of our pharmacists to explain on what actually happens in this department.
My name is Dr. Nafisa Gazi. I am a pharmacist at Mama Lucy. I work in the inpatient department. So this is the inpatient pharmacy. We do have our drugs here. In this department, we majorly focus on inpatient, which is the different wards that we have in the facility. We have the files that come here, and we work on it as with the shortest duration of time that we can. So as you can see, these are our drugs, the pharmaceutical drugs, which are arranged in alphabetical order. We do have antibiotic injectables, we have topicals, and we have injectables here that are non-antibiotics, and we also have tablets. So when we are dispensing these drugs, we dispense them to the files, the patient files that we do have here. These are patients who are majorly in the inpatient department. That is what we deal with. And we try our best to deal with the files in the shortest time possible, so that we can give them the best medical care, and we can give them the best health care. And this is also my team that I work with. As you can see, they are working on the files. So we have the files being brought in by the nurses, we work on them, and then they proceed back to the wards. Thank you.
My name is Thomas Jaggi, Farm Tech at Mama Lucy. And this is the main pharmacy. We have a lot of drugs. We dispense drugs to the patients. Currently, we have really stocked. Drugs actually, we have really increased our stock. We have drugs for pigs. We also have sunscreens here for people who have skin conditions. We also have drugs in the hospital for chronic diseases like diabetic and the hypertension. We also stock injectables and antibiotics. We also have drugs that are supposed to be kept under cold chain. They are always refrigerated. A drug like Mixtard and also Carboprost. We also have a new system for delivery of drugs, for stock taking, and also for dispensing to patients. This is a new drug system. It's called Afya Kenya Digital Health Platform, where we key in the ID number of the patient, and then it reflects the drugs that have been prescribed to the patient, and also the areas that the patient has visited, whether the triage, consultation room, or even theater.
We have managed to finalize construction, equipping and rolling out a dental and musculofacial center with 6 dental chairs and the first pediatric dentistry. This is a phenomenon that has not been overheard for a long time. We are able to manufacture people's teeth. We have a dental lab functional.
And this is our restorative unit. And when you come here for your dental services, you will find this machine state of the art, brand new, to provide services to our patients when they come to Mama Lucy Kibaki Hospital.
Welcome to Mama Lucy Hospital Dental Department. I'm Dr. Mwendwa Kamundi, the dental officer in charge. Our newly developed department has several components. We address your needs in different ways. We have the department that works on the diagnosis and finding out what is wrong with each patient. Thereafter, depending on what needs to be done, we refer you to different subunits. We have the pediatric unit, which is specializing for children under the age of 14. We have the periodontal department that works on your gum health and oral diseases. We have the conservative department that works on refilling your teeth and restoring damaged teeth. We also have the maxillofacial department that specializes on looking at oral tumors, looking at a variety of facial deformities and fractures. We have the exodontia department where we remove teeth that are offensive and are no longer restorable. We also have our dental lab where we fabricate and make different prostheses that are able to restore function to our patients.
The hospital's physiotherapy department provides essential rehabilitation services, helping patients recover from injuries and surgeries. The dedicated team of physiotherapists works with patients to improve their mobility and overall quality of life.
Good evening and welcome to Mama Lucy Kibaki Hospital. My name is Peter Wajie, a physiotherapist in Mama Lucy Kibaki Hospital. In the physiotherapy department, we receive patients who have pain and have been affected with daily living activities. We alleviate pain and increase mobility so that patient may go back to their normal work and duties. Welcome. And in physiotherapy, we divide physiotherapy for people to understand in 3 segments. We have electrotherapy. Electrotherapy is where we use machine to give heat to patient so that it may alleviate pain. Also, we have soft tissue manipulation. Is where we do manual therapy to improve and alleviate pain on a patient. Also, we have something we call therapeutic exercise. Like here you can see our patient is continuing with something we call static bicycle. Static bicycle, we are helping this patient to have strength of the lower ribs. Lower ribs is legs. So we are strengthening quadriceps and hamstrings so that the patient may be in a position to walk and resume his normal duties.
Welcome to Mama Lucy Kibaki Hospital. Mama Lucy Kibaki Hospital is a level 5 hospital situated in the eastlands of this capital, Nairobi capital, Komarok Ward. Mama Lucy Kibaki Hospital offers various services. One of the services offered in Mama Lucy is occupational therapy. And my name is Michael Mwangi, an occupational therapist. I want to take you through what happens in occupational therapy. Occupational therapy per se is divided into 3 sections. The first one is pediatric, applied to occupational therapy. Then we have physical dysfunctions applied to occupational therapy, and then psychiatric conditions applied to occupational therapy. But here in Mama Lucy specifically, they are dealing with physical dysfunctions and pediatric occupational therapy. Now, more specifically, when I come to occupational therapy applied to pediatrics, we have various conditions like derailed developmental milestones. That's the main issue. When you have conditions like cerebral palsy, derailed developmental milestones brought about by lack of nutrition, proper nutrition, children tend to delay. So we use various methods and various items and various media to train those children who are delayed in their developmental milestones. For example, this ball here you see here, this one is, we call it tactile therapy ball. You see it has spikes. There are some children who actually have different things, the challenges in tactile functions. So that's why we are using this spiked therapy ball. Then we have this ordinary one. Use it in various ways in training in head control in all those areas. So we have also divided these pediatrics into other things, like we have introduced sensory integration therapy services in Mama Lucy here in the occupational therapy department. We have given it a specific day because those children having sensory integration issues are a bit difficult to deal with, and they need an environment which kind of controlled. That's why we give them specific day. That's on a Wednesday. So on top of that, we're also making various splints for physical dysfunctions, which are dealing specifically with hard therapy. For example, this is an item that we call standing cum sitting aids. This one is used to train children who have delayed developmental milestones in standing, and at the same time in sitting. This side for standing, this side is used for sitting. You put them here, and then this it is designed in a way that the child will be able to sit here, put this board here, so that you give items like these ones for the child to keep on playing with. Therefore, they will not concentrate on their sitting, but they will concentrate on the activities which they are given here. So this is one of the items we use. Then we have this one. We use it for, it is called a walking frame. This is used for training children in walking. You can see them. It has rollers and it has pads, so that the speed is controlled. We are taking risks, and they're taking factors so that we minimize the risks. So some of the items that actually we have. This one is what we refer to as therapy mirror. This therapy mirror is used to train children to learn their body parts. Like when you want a child to know this is a nose, you point the nose and the child is looking at this one. You can tell this is your finger, then you're showing it, and then you can see it here. It is specifically for training those areas of interest for those children who have challenges, so that you can be able to learn the different parts of their bodies and so many other things. Even when you want to train them in other activities, they can still use this mirror. They can see themselves using this reflection, and then they are able to learn because it's physical.
Social workers at Mama Lucy Kibaki Hospital play a vital role in patient care. They offer counseling, support services on bill payments, and assistance with social issues, helping patients navigate the complexities of their healthcare journey.
I want to take this opportunity to welcome you to Mama Lucy Kibaki Hospital. Mama Lucy Kibaki Hospital is a level 5 hospital offering a wide range of services. And I come in as a medical social worker, part of the team that offers psychosocial support to our clients. Our work as medical social workers is to offer psychosocial support to clients. As you are aware, World Health defines health as that complete well-being, physically, mentally, socially, psychologically, religiously, and not just merely the absence of illnesses. That is why patients have to be handled by a team of experts, because they have various needs which should be addressed by various specialists. So that is why we come in as psychosocial support. Where medical doctors have failed, we come in and now complement them. So some of the functions or roles we undertake is follow-up of clients. We have some clients who come here. I can use an example of CCC clients who may need follow-up because adherence at times becomes an issue. So it is our work to follow them up either through the phone or a home visit to see how they are progressing so that they can continue with that treatment. It is not easy. So we do a lot of follow-ups. We also do a lot of home visits to ensure that our clients adhere to treatment. We also act as advocates for the clients when we are in the hospital. It is our another key role. We advocate for the rights of patients. In case there is any disagreement between patients and staffs or patients and patients, it is our work to advocate and also mediate. So another key role is that we mediate. Quite often, we get clients abandoned here, and you find that maybe it was because at home there is no peace, there are conflicts. So that is how we come in through mediation and family conferences to ensure that the patient and the relatives are in a good relationship so that they can support the client as he walks with the treatment journey. We also have patients who come here and due to one reason or another may not be able to pay the whole bill. We also do thorough assessment. After we are convinced that they may not pay the entire bill, then it is our duty to recommend to the waiver committee. We don't waive in patient cases. We only recommend to the waiver committee so that the waiver committee can discuss, and if they feel the case deserves waiver, they recommend, they approve, and the patients are left to go home. We have quite a number of many patients who may not pay their whole bill because economic conditions. And our catchment area, it is for the majority of them are low class. But even though we are encouraging them to register with the national insurance scheme so that we can reduce that burden of waiver. That is also another key area where we participate in sensitization and awareness creation so that these clients can be self-reliant to avoid waiver, because waiver eats into money that can make our hospital better in terms of equipment and service delivered to our patients. This is where we take our history. Before waiving or recommending for waiver, we have to take thorough history that when the committee looks at, agrees that indeed they deserve waiver.
I am Patience Shigadi Kenze, medical social worker in this facility. I thank God so much for Mr. Julius who came and joined us some 3 years ago. And when he came, I was just alone in this facility. I was working all around, and until he came, now the work has become much lighter. and he is the head of department. So I must say I'm very thankful to our head of department, Ms. Rosaline Mukabana, and the MedSup, and the CEO at large, not forgetting the Deputy MedSup, Dr. Diana Nyabuti. We are working as a team, and our joy is serving our patients. We say that the patients are our first priority.
First thing I want to say that we really depend on God. Our work, we really rely on God, and that is why every morning we pray. We have a pastor for each day who gives us one verse or two, then after that we pray. And that's why you can see the Bible on our table, and it has never failed us, because during our work we meet some clients who are very rude, some who have just come to cause drama, but because we have the word of God, we know how to handle them, and that is why we are soldiering on.
My name is Dr. Diana Nyabuti, Deputy Medical Superintendent, Mamalusi Kibaki Hospital, Head of Clinical Services. We have made many developments in the range of services that we offer at the facility. Recently, we opened our NICU and PICU, where we offer critical care to the neonatals and the pediatric population. We have also recently launched a service that is offered every Thursday of the week by a Dr. Ngugi. That is going to be the pediatric echoes. So we're no longer referring our patients out. We are handling them here. That includes patients from other county facilities like Mutwini, Mbagathi, and Pumwani. Other range of services that we've added to the facility is that we now have a fully fledged orthopedic department with an orthopedic ward and an orthopedic theater, so we will be handling all the surgeries here, and we have a burns unit that is in the development works that will soon be completed. As head of clinical services, my work is to ensure that the departments run smoothly, that we are well staffed, that all the commodities are available to offer the highest quality of care to the clients who come to seek services in the facility. The NICU and PICU services are charged, and the hospital accepts a variety of payment modes from M-Pesa to insurance. The current insurance carrier that we are accepting as a facility is NHIF. So I would encourage all our patient population to register with NHIF to enable you access services easier and cheaply at the facility. Thank you.
My name is Catherine Jenga. So I'm a nutritionist dietitian in the nutrition department at Mamalusi Kibaki Hospital. So in the nutrition department, we carry out different services. So we do nutrition assessment, which involves the anthropometrics assessment, whereby we take the weights, the height, the marks of children and also adults. We also do clinical assessments and also dietary assessment of each patient. When a patient is coming to the nutrition clinic, they usually start at the triage area. So this is where documentation for the patient details takes place. So the patient is documented the details. Then we go to the assessment. These are the anthropometrics assessments. So these are the tools that we use. We take their weights, and then again we take the child's length, where the child is lying down. So they're supposed to have minimal clothing. And then we also take the patient's mark, the mid-upper arm circumference. And if a child should be given vitamin A, that is a child who is either 6 to 11 months, they're usually given vitamin A, or 12 to 59 months, they're given vitamin A. So once that is done, then the child is either forwarded to the outpatient pediatrics to see a clinician, or to the nutrition clinic. Then other services that we offer is the nutrition education and counseling. We are able to guide the patient on the different dietary guidelines of the patient, and also be able to also do meal plans for a patient. We also guide the patient on the different meals that they're supposed to take. Then other services that we offer, we also supplement the patient with different nutrition commodities that we have in the facility. And then also we have different departments that we carry on our services. We have the outpatient pediatrics, that is a nutritionist station there. We are also in the outpatient adults. We are in the child welfare clinic. We also offer our services in the inpatient pediatrics, also in the medical ward, in the ICU and renal unit. We also have nutritionists there. We also offer our services in the TB/CCC, and we also support the kitchen, whereby we have a nutritionist who is able to guide on the specialized diets for the patients who are usually in the wards. Then we also have, we can say we have achievements that we've seen throughout the years. At least now we can say we're able to have commodities for our patients, both for the inpatient adults and also the pediatrics, the nutraceuticals. At least we're able to be supported by the hospital. We also have an increased recovery rate for our patients. We've seen over the years and over the time in the inpatient and also in the outpatient, whereby we have different programs for nutrition.
The recent expansion of the emergency department has significantly increased the hospital's capacity to handle urgent medical cases.
We are proud that for the last 100 days, we have managed to do 31 projects successfully. And currently, as we speak now, we are finalizing emergency and accident, expanding it so that we continue seeing more Nairobians. Additional to that, we are also finalizing on a burns unit. In the whole county, we didn't have any burns unit, but now at Mama Lucy Kibaki Hospital, we are going to have a burns unit.
The hospital's blood bank services are essential in saving lives. By ensuring a steady supply of safe blood, the blood bank supports various medical procedures and emergency care.
This is Mama Lucy Kibaki Hospital Satellite Blood Bank. What we do here is blood donation, and we do collection of blood from various places, volunteer donors, relative donors. We do the process, screening, and storage. We also store blood. We also go out to colleges, other learning institutions, corporates, universities, and we collect that blood. We bring it here for processing and storage and also distribution. We also distribute that blood to surrounding hospitals. Apart from our own hospital and other county hospitals, we also distribute to private hospitals that surrounding the hospital. So the blood donation happens here every day, Monday to Friday basically. But if we have a group coming that maybe a church can book that they want to come on a donation on a weekend, we can organize for them. We have a ground, we place a tent for them, then we can also do collection even on weekends. We also go out even on weekends and every day of the week. Basically blood donation is for every day of the week. And we welcome everybody, and we encourage everybody to be a blood donor, because blood donation saves life. That is what we do, saving life through blood donation. So at this point, what we are doing here, once the donor comes from outside, we receive the donor here at this desk. Then we do an assessment for suitability. First, the donor has to be of sound mind, able to make his own decision, and of the right age. The minimum age is 16, up to 65 years of age. Both men and women are encouraged to donate blood. But the women, we have a more specific recruitment process or an assessment, because they should not be pregnant, they should not be breastfeeding, and the donor should not be on any medication, they should not have an underlying condition. So they should be very healthy and very fit, not drunk, and also not taking any drugs like marijuana or cocaine or something like that, or any medication basically, because that medication, when it goes to the patient, it may interact with the patient medication, or it may harm the patient in ways that we do not know. So the donor, the assessment that we do here, we have a lab technologist here doing an assessment. It can also be done by a nurse, but today we have a lab technologist. We do blood pressure, and the blood pressure has to be within the normal, that is between 90 to 150 for both sexes. And hemoglobin, the minimum should be 12.5 grams up to 18.5. Weight, minimum weight is 50 kilograms and maximum weight is 120 kilograms. So we also have a questionnaire that we take the donors through. The questionnaire will also help us. It guides us in how to assess the suitability of the donor. It does a risk assessment, maybe on travel history and risky behavior, or even occupation. So that assessment, that questionnaire also guides us on how to qualify a donor. So we have a donor here who is currently undergoing assessment, and we hope that he will qualify. And he looks happy, and someone must have eaten. So when I spoke to him earlier, alikuwa amesema amekula na alisema yeye ni pasta. So he's a donor, sio mara ya kwanza, ashatoa damu tena before.
By donating blood, you become part of a life-saving mission. Your donation is meticulously processed, screened, and stored, ensuring it reaches those in need in the safest manner possible. By donating, you contribute to the supply of essential blood products such as red blood cells, plasma, platelets, and fresh frozen plasma.
Welcome to Mama Lucy Kibaki Hospital, Cervical and Breast Cancer Screening Center.
Early detection is key to successful cancer treatment. Mama Lucy Kibaki Hospital offers extensive cancer screening services for mothers, helping to identify and diagnose various cancers at their earliest stages. This proactive approach significantly improves the chances of successful treatment and recovery.
And this is where we also do cervical cancer screening. This center was put up by the BD Africa, and we are grateful to BD Africa and National Cancer Institute for this center. We are here to serve our communities and make sure that whatever we can do to reduce the harm that has been caused by cancer, that we do it at Mama Lucy Kibaki Hospital.
My name is Makoha Jonathan James. I am a clinical officer and I specialize in oncology and palliative care. This is our screening area, and we are screening for the cancers of the breast. We are also screening for the cancers of the cervix. In breast cancer, we are encouraging our patients to do self-examination at home. And when they come here, we are doing clinical examination. And in the clinical examination, those ones who are found to be having suspected lesions of the breast, we are sending them for further investigations like the breast ultrasounds and also the mammogram. All the services are available here at an affordable price. Those ones who are found to be having the signs of cancer, and when they are in early stages, we send them for further management and treatment. We are also screening for cervical cancer, and in cervical cancer, we are doing pap smears at affordable prices. And those ones who are found with suspected lesions, which are precancerous, we are also able to do what we call lip treatment. Lip treatment is treatment for early cancer lesions of the cervix. We are also doing other screening for other cancers, like for example prostate cancer. We are doing the tumor markers, and also other cancers. We have the tumor markers available in the hospital at an affordable price. We are looking forward for Mama Lucy to become a one-stop center for screening, for diagnosis, and for treatment of cancer. We are putting up a good place, and we are welcoming all of our clients who live within this area to come for the screening of cancer and for the treatment and for the advice from our professionals who are here to tend to you. Thank you.
Good nutrition is a cornerstone of patient recovery and staff well-being. The kitchen at Mama Lucy Kibaki Hospital operates with precision and care, ensuring that all meals are nutritious and prepared with the highest standards of hygiene.
I'm Christine Openda, Hospitality Department in charge, Mama Lucy Kibaki Hospital. Hospitality Department has staffs comprising of both casual and permanent staff. We have chefs, we have cooks, we have servers. Hospitality Department in Mama Lucy Hospital caters for all inpatients, caters for staff needs, caters for meetings, both scheduled and unscheduled, board meetings, and any other meeting that is scheduled by the management. In Hospitality Department, it's a busy department where we report to work by 7 in the morning. We do 3 shifts, rotational, morning shift, afternoon, and night shift. And basically, our menu consists of breakfast in the morning. We have lunch for all inpatients and other staff members who work in very sensitive areas and cannot go out for lunch, like theater and emergency departments. We also do night shift, and we prepare tea for our night staff to motivate them at night. Now, in the kitchen, this is our dispense kitchen, whereby we have equipment that you can see. Initially, we never used to have TNs, but this quarter, the management managed to get us TNs. As you can see, we now have TNs that we can use to serve tea to our patients comfortably and hygienically. We also have food insets and trolleys that we use to serve our lunch and dinner. Like now, we are serving dinner to our patients for today. We also have the boilers that we are using to cook food for our staff, for our patients, and any other meetings within the hospital. We have a cooker where we used to prepare our special meals for our special patients, the ICU, with the renal patients, the DM patients, and any other patient that needs special attention. As you can see, most of our production is not done manually. At the moment, we have a potato peeler, which was currently purchased this quarter to aid in peeling potatoes that we use to prepare food, especially the total diet for our babies in PEDS department. This is a cooker. We have a chef, Rahab, who is now preparing dinner for our patients. In hospitality department, we have storage units for food, especially perishables. So in Mama Lucy, we have enough food for our patients, both vegetables and dry food. As you can see in our cold room, we have enough food in our cold room. This is our cold room. The cold room is used to store vegetables, the perishables. We have sukuma wiki, we have cabbages, we have carrots, we have green bananas for our patients. We have bread for our staff, tea. So this is basically our cold room where we store all the food items which are perishable. We have a food store, main food store for dry food stuff, but that store is run by procurement.
The Tumani Free Clinic offers invaluable support by dealing with health-related legal cases.
Welcome to Tumaini Clinic. This is a sexual and gender-based violence clinic at Mama Lucy. Here we take care of sexual violence, that is anything ranging from defilement to rape and all that is in between. We also deal with gender violence, gender-based violence, has a big range also from intimate partner violence to non-intimate partner violence to female genital mutilation. We take care of people here. This is a free clinic. Nothing is charged. It is also a one-stop clinic whereby patients walk in. As they walk into the first center here, this is the nursing station. From the nursing station, we take a brief history. Then from the history, we do our own forensic examination. we take our samples, we give the treatment and the necessary prophylaxis. At the far end of this clinic, we have the medical legal station. That's where I sit as part of the team. My name is Dr. Farah Mohammed. I do write the P3s and I do appear in court for all these cases. Thank you very much. Karibuni to Maini Clinic.
Ensuring a reliable supply of medical oxygen is crucial for patient care at Mama Lucy Kibaki Hospital. The medical oxygen production plant plays a vital role in producing and distributing high-quality oxygen for use in medical treatments and procedures. Welcome to Mama Lucy Kibaki Hospital's Orthopedic Technology Department. We specialize in creating orthopedic appliances for our patients, offering support, correction, and compensation.
My name is Martin Ngure. I'm the deputy head of department. In this department, we do a number of things like we offer supportive appliances. We also offer corrective appliances. We also offer compensative appliances. By that I mean, like whatever I'm holding here, this is an elbow crutch. Elbow crutch is for supporting the client after maybe fracture or maybe after amputation. So we have the same type, another type of crutch, which is axial, which means this is a total weight bearing crutch when a fracture or an amputation has been done, and the contralateral leg also has some injuries. So we need complete support from the crutches. Then we have compensative appliance, like when somebody has a shortening, maybe because of an accident, or somebody has been born like that, one side is short, we compensate for that height. We do LASIK for the shoe so that you don't have tilting of the spine because of having one side of the leg shorter. Whatever I'm holding here, these are below knee prosthesis, and the client has lost his leg just below the knee, maybe 8 or 7 inches or from the knee center. Here we have corrective, as I said earlier on. These two go together. This shoe has a wedge. If you look from the middle side of the foot, there's a wedge. The brown material is a wedge on the middle side of the foot, such that when the child will step on the ground, there will be a force moving the knee joint out. Meaning, at night we also use an Arium sprint they go hand in hand. During the day we have the shoe, at night we have an Arium sprint or a single back sprint.
At Mama Lucy Kibaki Hospital, our auto trauma department is dedicated to providing exceptional care for patients involved in accidents or with a history of falls.
My name is Gladys Atambo, the head of orthopedic trauma in Mama Lucy Kibaki Hospital, whereby we normally see patients who have been involved in accidents or with history of a fall. In Mama Lucy Kibaki Hospital, we normally see so many patients because the catchment area is big. In a month, we normally see like 2,000 patients. And our patients, they normally like coming to Mama Lucy Kibaki Hospital, especially in the auto trauma department, because we give the best services. And now here I'm in the ward, the orthopedic ward. This is the reception and the nursing station. And then we have the preparation room, which has 3 beds. This is where we receive our patients from when we want to prepare them for theater. This is where we prepare them from. We have 3 beds. At least we are happy with our governor
and our CEO, the management, for the good work done. And then we have the observation room, where our patients who have been received from theatre, this is where they are observed from. This is where we receive our patients. Once the patients have come from theatre, we receive them here. They're being monitored here before they're taken to the general ward. Already this patient has been taken to theatre. The patient had a fractured tibia fibula and it was compound. So the patient was taken to theatre and the exofix were fixed. Now is recovering well. The dressing is being done every day and the patient is happy. The good thing with having an orthopedic theatre, we'll be seeing patients, the patients will be seen here every day, as in they will be operated every day. Now surgery can be done every day. And like there before, whereby we have been having one day in a week, whereby we do our surgery for the patients who have been involved in accidents. But now we have an orthopedic theatre whereby the surgeons will be able to see patients every day who needs to be done surgery. So we thank our CEO and our governor and our chief, our three chiefs for the good work done. Welcome to Mama Lucy Kibaki Hospital, whereby there will be no delay for any patient who has been involved in an accident and who needs surgery.
Behind the scenes, the finance and procurement departments play a crucial role in ensuring the hospital runs smoothly. Their diligent work ensures that the hospital is well-funded and well-stocked, enabling medical professionals to provide the best care possible.
My name is Isaac Karanja Mkonyi. This is the procurement office, and the procurement office is comprises of, I'm the deputy procurement officer. The procurement office comprises of 8 procurement officers, divided into 2, procurement side and the stores. The stores are for receiving and keeping data for the goods that have come in. And the officers in procurement are in charge of procuring in certain departments, ranging from pharmacy to non-pharmaceuticals and other departments. This award was given to the department as the best department in the hospital.
My name is Lucy Mudama. I'm in charge of supply chain management here at Mama Lucy. I'm proud to say that I'm part of a system that is working, because supply chain is the backbone of any facility, because we make sure that the goods are delivered on time and are cost effective. We have management that helps us and we work with from City Hall, and that is our supply chain director, in collaboration with the CEC and the chief officers that are under the health sector. We also have the board, senior top management here at Mama Lucy, which makes sure that we have people of integrity here at supply chain management, and the system are flowing. We have integration between various departments, which enables the flow, and there is no friction between the supplies that are being delivered to the facility. We also have a stores department. Pharmaceuticals, or rather medicine, is a very sensitive product that needs a proper storage. In that, we have measures which curb that and are under refrigeration, which makes sure that the medicine does not disintegrate or lose its component value that is going to be helpful to the patient at the long run. As we stand, Mama Lucy supply chain management process is a process that is full of integrity, it's clear, and it's transparent for any person who's willing to do business with us. We are looking forward to our senior top management program. They want to incorporate a system that is going to be digital, whereby you're going to be conducting the supply chain process or procurement is going to be done online. So it means it will be even more better than it was before. So I'm very proud to be part of this facility. There's growth, and I'm looking forward to continue being part of the growth here at Mama Lucy because the process is seamless, and it's going to be. It just has to work, and we are here to make sure that it does work.
Welcome to Mama Lucy Kibaki Hospital. I'm Monica Moreithi. I work in finance as accountant. In accounts, we have 4 sections. One is NHIF, that is claim office. We have cash office, we have billing, and where we are right now, it's payment office. In Mama Lucy Kibaki Hospital, we offer various services, and that's how we raise our revenue, through many services that we offer to our clients. We encourage our client to pay through M-Pesa payment, which is more convenient to them, and also it creates more transparency and accountability when this money is paid through M-Pesa, because it's later deposited to our to access this revenue from our account. There are various processes that has to be undergone. The board must give approval for the expenditure to this revenue. There are various stages. We start with a request from the head of the department. They put on their request in a HMT meeting. After the HMT meeting, there's another meeting that's usually held by the management, the head of the management, that is EEC meeting. Then there is another meeting that the budget has to go through. This is JPFC, General Purpose Finance Committee, which consists of board, management, and the board members. After all these meetings, and the final one being the hospital management board, that is when we are given the approval to spend money from the account. We welcome you all to Mama Lucy Kibaki Hospital. Afya yako fahali yetu. Thank you.
Welcome to Mama Lucy Kibaki Hospital. Mama Lucy Kibaki Hospital is a level 5 hospital that is situated in Eastland, Spine Road off Kangundo Road. It serves almost the whole population of Nairobi and its environs. As I said, is a level 5 hospital providing both treatment and diagnostic services. We see approximately 3,000 patients per day. And we have several facilities that we have in the hospital. In the part of human resource, we are blessed to have close to 600 staffs. Of these 600 staffs, 41 are consultants of various levels and various areas. And of course, we also have medical officers, clinical officers, nurses, and all the other cadres of staffs. As an administrator, I am in charge of issues that are related to human resource, issues that are related to finance, issues are related to procurement. And in procurement, my duty is to ensure that all the supplies that are required are available to ensure that the services are running as expected. We currently have a bed capacity of 280, but we intend to increase. We have a building that is ongoing that will increase our bed capacity by 400 beds. Some of these infrastructure projects include we are opening an orthopedic ward where we shall have patients with orthopedic issues admitted in Mama Lucy Kibaki Hospital. That is going to be a very important service, considering that Mama Lucy is situated in very important highways where accidents happen, and we are sure that this will alleviate the problems that are associated with the accidents. The other service that is very important is the issues of the CT scan that we recently acquired, and this has really assisted our patients. Previously, they used to go all the way to Kenyatta and even the private facilities, but now we are able to assist them and even improve on the turnaround time for our patients. We also have ICU services. It's currently above 4-bed ICU services, but we are working to increase it to 16 bed capacity. We have just launched our NICU that will take care of our newborns that require intensive care unit, care services, and even the pediatric patients. We're also launching a PICU. The facility has 3 ambulances that are all roadworthy, that are serving the patient in issues that related to transfers of patients to various facilities. Mostly we transfer our patients to KNH and even KU. And we have other vehicles that also help us with our daily operation. Under these we have 4 other vehicles, 2 being pickups and another 2 being double cabs. So in the area of mobility, we are okay. To ensure that our patients are served well, we have engaged customer care officers that we engage through the facility that ensure that patients are directed properly. And we also thank the county through His Excellency the Governor. They have seconded a customer care officer who are also helping us in the facility to ensure that our patients experience the best quality of care in the facility. To ensure that everybody is secure, we have AP officers who are seconded from the nearest disease office here, and who are here 24 hours to ensure that our security as staffs and client in the facility is taken care of. As a facility, we have also engaged our internal security to ensure that everything else goes well. Everybody knows exactly what they are supposed to do in the facility, and also to help us ensure that we collect the maximum revenue that we need to collect. And knowing very well that most of our patients that we see may not be able to pay the bills as we may wish, we have a very vibrant social work that ensures that we don't detain patients. When they are not able to pay, then we should find a way of releasing them and ensuring that we are also able to provide care to the next patient. We have several equipments, both medical and even plans that ensure that we are able to provide the services. And these equipments require around 24 hours maintenance. And for that, we have a whole department of biomedical engineering that ensure that our equipments are maintained and up to date. And this department serves 24 hours a day, and they're always on call to to fix any issue that are related to equipment. Because cleanliness is next to godliness, we have ensured that our environment is kept clean all the time. And to this effect, we have engaged a cleaning company whose work is just to ensure that the environment is clean, everything is well done, the lawn is cared for, the environment is good in general. So this ensures that ensure that we only focus on areas that are important to the patient, and leave these other areas to the outsourced companies. Also to ensure that our services run well, we want to thank Kenya Power because they have ensured that we are connected to the grid 24 hours. And when, in case of any outages, we have a very powerful generator, 515 kVA that assists the facility. So at any given time, we will always have power. In case the main generator fails, then we have another one that is connected in series that will come on immediately. So we are sorted in terms of issues of power, and on water, we are connected to Nairobi Water, and also have a borehole that ensures that we have these precious commodities 24 hours a day.
The success of Mama Lucy Kibaki Hospital is bolstered by strategic partnerships with renowned organizations like D Africa, World Family Foundation, Safaricom, JKUAT, and Indiana University.
Our friend and partner, Sherry, the most important people, the trainers, the trainees of today. Good morning. Habari za asubuhi. Uko salama? We're just telling Chair that now, when you start seeing mannequins, then you know you've become a teaching hospital. Madam Chair, after this training, these members are going to be certified. We will be able to come back here and give them their certificate and empower them to go and train other people. So part of the objective is, after this training, we are going to set up a center for Help a Baby Breathe training center, that other institutions will be able to come here and be trained by these members that are going to be trained today. Coincidentally, this training precedes the research that is going to start next month on preterm babies in Africa. And again, we are privileged to have been selected among the center for that research in Africa, as again, it is supported by Indiana University through the Open Philanthropist of America.
I am the department chair for Community and Global Health at Indiana University in Indianapolis, Indiana, at the Fairbanks School of Public Health. I'm also an associate professor of pediatrics in the Department of Neonatal Perinatal Medicine at the IU School of Medicine. And it's my great pleasure to be here today to facilitate newborn training, especially in neonatal resuscitation, with partners from JKUAT College of Health Sciences, with my long-term colleague, Jeffrey Mwai, who we've worked with since 2008 on HBB, and of course with partners here at Mama Lucy Kibaki Hospital. Thank you for the very warm welcome, and I look forward to our work today. Asante.
I would like to truly appreciate the collaboration we have between Jomo Kenyatta University of Agriculture and Technology and Indiana University, who came to us through JKUAT. So I want to appreciate that deeply, because our relationship It's getting better every time, you know. Dr. Thuo, every time it's this, is that, is this, is that. So we're like, wow, what a partner to have. Because every time you have good fruits, you're not eating them alone. You're sharing them with Mama Lucy. And in turn, our staff are also actually benefiting out of that. So that's my number one point. Number two, our staff in Mama Lucy, some will have met us, some have not met us, but some hear about us or some see us and walk away. But nevertheless, our staff, they do know that the board is pretty aggressive in trying to change the face and the narrative of Mama Lucy Kibaki, making sure that our staff are supported to the extent they need to be supported, giving you access to whatever programs that will enrich your professional lives, but also your own, you know, general life here, you know, making sure you have a good working environment as well. But that can only go in tandem with upskilling you to be better clinicians that you should be. And this particular program on neonatal respiratory support, I hope I got it right, Dr. Musa, trying to be a doctor in my own way, is very important for our staff and for our facility. And that out of this, we want to have a team of staff that will become trainer of trainers, you know, so that we expand this skill to others, not necessarily in Mama Lucy, but outside of Mama Lucy. We have other facilities that can benefit from that in Bagati, Wadi, and wherever else within the county of Nairobi.
These collaborations have facilitated the hospital's growth and enabled it to offer more comprehensive services. The board's dedication to fostering partnerships with universities has also enabled cutting-edge research, ensuring the hospital remains at the forefront of medical advancements.
This is our ENT unit, and in this particular room is an audiometry room. This room is where testing of ear, the hearing of patients happens. And therefore in Mama Lucy Kibaki, we welcome you to this unit, and it's soundproofed so that it's easier and possible for a doctor to detect whatever hearing problem a patient may have.
The leadership of Dr. Wafula as CEO, along with the entire board, has been pivotal in driving the hospital's vision forward.
CHP attached at Mama Lucy. I'm the team leader. We are 40 of us. Kazi yetu hapa Mama Lucy ni venye tuna coordinate community na Mama Lucy. Sasa kama in case tuna mgonjwa, Mama Lucy wanatusaidia sana, cause kuna venye tumerinikiwa Mama Lucy, zile cases ziko kwa kijiji. In case of any activity, either kama ni TB screening ama kuna cancer ama nini, anything activity within Mama Lucy from the community, we are the link wenye wanahusika. Pia si ndio tunafanya referral Mama Lucy, na Mama Lucy wamekuwa maana sana, wametusaidia cause kitambo ilikuwa hatukuwa na hiyo rapo na hospitali, lakini tangu CHP wakuwe attached na link na facility imekuwa ya msaada sana, cause unapata sisi ndio tunafuatilia hata wale wagonjwa wenye wameshindwa kutoka, ndio tunasaidiana na social work kufollow up from the community, kujua venye kama ni mtuebo, si ndio tuna follow up in the needed cases. Na we really appreciate the Mama Lucy board ikiongozwa ni Wafula na Madam Helen, akina Alex, akina Dan. The board wamekuwa wa maana sana, cause tukipata na mgonjwa hata kama ni kwa kijiji mwenye ana lolote, bora tu atibiwe, wao wanamsimamia na kila kitu. Pia kuna wale wetu wagonjwa wako kwa ward, ikikuwa ni kukua mambo na discharge, unapata wanatuita ndio tuweze kufuatilia, tujue the need of the case, na wamekuwa maana sana, wao ndio wamekuwa kitusaidia. Sasa kitu tunaweza sema Mama Lucy imekuwa ya maana sana kwa community. They have formed a good rapport, cause wagonjwa wenye tunaleta kutoka kwa kijiji, mtu akuwe na pesa ama hawana, they have been doing the very necessary ile wanaweza saidia, na wamekuwa wakisaidia na wamekuwa wa maana kwa hii community yenye imezunguka Mama Lucy. Pia mimi Catherine Jerry, mimi ndio secretary Nairobi County. Kwa hivyo tunapata referral with Nairobi yote. Unapata tunapata referral from the other CHP, ila tu nikipigiwa simu na kuwa na warinki na mama harusi and the board wanaweza kuishughulikia. Tunashughulikia board ya mama harusi, the staff of mama harusi, wenye watu wako hapa wanasaidia na imekuwa ya msaada sana kwa community.
We've started telemedicine and we are working with our community health promoters. What we are saying is that there are elements that do not need to have somebody come to the hospital, and the community health promoter can simply on their phone transfer the information to the doctor or consultant, and the patient can be told what to do at the comfort of their home. We have also, installed 40 Bluetooth monitors in our neonatal baby unit, so that you can monitor the babies from the phone, so that you make sure children are well. We don't have to have manpower situated in that unit, and therefore that also creates efficiency.
Mama Lucy Kibaki Hospital is more than just a hospital. It's a symbol of hope and a testament to the power of community, innovation, and dedication.
Our staff have their own welfare that they are running. They actually run a welfare canteen that simply belongs to staff, and the proceeds out of that is what they use to support each other, especially when they're bereaved or even when they're having their own personal celebrations. So they have a welfare canteen situated within the facility. We want to also acknowledge the fact that our strategic plan is at tail end of formulation, and our staff have played a key role, because if they do not formulate this plan and they're the ones who are implementing it, then it's not going to work. And therefore our staff are the ones formulating this, because they shall implement that.
Regular social activities, such as birthday celebrations and team building events, foster a supportive and joyful work environment.
We have started oncology center with 3 oncologists, and we are in the process of establishing a chemotherapy center so that we are able to address the issues of cancer. As we continue to improve our services, we have embarked on growing our human resources. We are now giving trainings in leadership and management for the middle level managers, the HODs in charges, covering nurses. We started off by mindset training so that we train our staff on how to focus and get things done faster. We have managed to improve the waiting area and our reception area so that we give the Nairobians a dignity that they need.
The health team from Nairobi County has worked hand in hand with the hospital staff, ensuring seamless delivery of services. The collaboration has been instrumental in expanding the hospital's reach and improving the quality of care provided. Together, they have navigated challenges and celebrated successes, united in their mission to enhance public health.
We are very glad for the support that we get from the management board led by Dorcas Kemunto, the staff of Mama Lucy Kibaki Hospital that endeavor every day, seeing so many patients, seeing 3,800 patients per day, seeing 500 children per day, delivering 40 mothers per day, doing 25 cesarean sections per day. All this work doesn't go in vain, that Mama Lucy Kibaki becomes a peacock of hope and giving life to Nairobians. Thank you so much, and I welcome you to Mama Lucy Kibaki Hospital. Let us come and have our health. As they say, health is wealth. And as the saying goes, afya yako fahari yetu. karibuni sana.
I invite other Kenyans from other counties, from other parts of the country to visit Mama Lucy Kibaki to receive services. And our services are focused on ensuring it's dignified and it's respectful patient care that we are going to provide to you. Everyone is welcome to Mama Lucy Kibaki Hospital.